Okay, so we have some pretty basic objectives for this webinar today. We hope to be able to talk about understanding the important role of families in the health care of their children. We are going to be talking about tips and tools for communicating effectively with your children's health care providers, but I hope that this will provide some practical tools for you to be able to communicate more effectively and partner more effectively with any of the providers that you work with. That would include working with social workers, any of the county staff, and school staff as well, therapists, and other people that you work with. So I'm hoping that you'll be able to learn some concrete tools that will help with the communication and partnership. And then we're going to talk just a little bit about the core concepts of medical home and healthcare home. So Family Voices of Minnesota is a nonprofit organization, and we are the state affiliate organization for Family Voices National and for Parent to Parent USA. Both of these organizations are located in most states across the country, and through these networks, we're able to provide information, tools, and support to assist families in navigating systems of care. So I want to start by talking very briefly about patient and family-centered care. This is really the foundation of being able to develop mutually beneficial partnerships. And the definition talks about patient and family-centered care as being an approach to the planning, delivery, and evaluation of healthcare that's really grounded in mutually beneficial partnerships. There are some core concepts and principles of patient and family-centered care that you'll see here, which basically tells us that people are treated with respect and dignity, that information is shared in unbiased and complete ways, that families participate in experiences that enhance control and independence, and that ever important collaboration among patients, families, and providers occurs not only in the care of individual children, but also in policy and program development, professional education, as well as that delivery of care. So patient and family-centered care recognizes that everyone has unique expertise and experience that has equal value. And one of the things that I like to think about with regard to this idea is as we form all of these different partnerships with different providers that we end up working with, it's important to remember that everyone brings some expertise to the team that is unique, and including families. And it is that unique expertise and experience that we bring that helps everyone else understand our children and our family. And it's so important to remember that that experience and expertise that we bring as families has that equal value to everyone else. And it's not to diminish the expertise and experience that providers bring, but it's to just remind us all that we have expertise that has equal value. So the idea of patient and family-centered care really redefines the relationships in healthcare. And again, it just talks about how important meaningful partnerships are. So I want to talk a little bit about primary care and why primary care is important. Many times, families whose children have complex needs, and even maybe less complex needs, but often see multiple specialists, the care can become fragmented when there isn't a central doctor who is helping the family, working with the family to help coordinate care and to communicate among the multiple different providers that the family may be working with. A primary care doctor should be someone who you know well and who you can develop a trusting relationship with. Sometimes having a primary care doctor is required by insurance, not all the time anymore, but it used to be an important requirement by insurance. Sometimes families kind of skip going to see their child's primary doctor because they have so many other appointments that they have to go to. But in order to have this trusting relationship, we have to go and see the doctors. We have to be able to develop that trusting relationship and ask for their help in coordinating and communicating with the other providers that you may be working with. This is especially important if your child ends up in the hospital, if your child requires care in an emergency department, and also in developing care plans. And we're going to be talking a little bit more about care plans as we go along. Sometimes that primary care doctor can be a buffer if the specialty physicians are not being helpful and there aren't other choices. Sometimes we don't have a choice in specialty care providers, but that primary care doctor may be able to help us better communicate with specialists. And also, the primary care doctor is someone who really should be able to look at the whole child and to be able to really look at the needs of the whole child and put the child in the context of the needs of the whole family. Specialty care providers usually tend to focus on their specific body part and are not always really good at looking at that big picture and the whole child. So that's something that primary care doctor can do. In Minnesota, we have a system called Healthcare Home. It's based on a concept called medical home. And the focus of medical home or healthcare home is this idea of having a primary care doctor who does help you coordinate care. So think about whether or not you have that really important trusting relationship with your primary care doctor and how you might use some of the tools we're talking about today to develop that relationship and get some better help from that primary doctor. We've talked about the idea already about the expertise that you bring, but one of the things that I want you to think about is the idea that you're a colleague in your child's care. You are not a patient. Your child is the patient, and you should really think about yourself as a colleague on the healthcare team. We talk a lot about the idea of partnerships, and partnership is sort of a term that we use a lot, and it's kind of infused in this presentation today. But I'd really like you to think about the difference between being a colleague and being a partner, and how thinking of yourself as a colleague may change somewhat how everyone else thinks about you on the team. For me, thinking about the idea of being a colleague seems to imply an equality that somehow partnership doesn't necessarily imply. So it's just something I wanted to throw out for you to think about. But As part of that healthcare team and a colleague, we also have a responsibility for good communication, good follow-up, and keeping good records. So that's a lot of what we're going to talk about today. The responsibilities of being a good team member, the responsibilities of being a colleague in your child's care. So you should think about the goals of good communication in a few different ways. So communication should be positive. It should always be respectful. And when it is positive and respectful, it will help you develop those trusting relationships that we've been talking about. When you have good communication, you have the ability, or a much better ability, to establish trusting relationships, to have an increase in satisfaction with the healthcare system and the other systems you work with, and better health outcomes for your child. I really like this quote, and it's something to really give some thought to. Seek first to understand and then to be understood. Communication is always a two-way street. So the important part I think we need to remember is that we have to listen and understand what the other person is talking about, and then work to communicate effectively our positions so that we can be better understood. This is not always easy, but it is a really important way to be a colleague in your child's care. So some of the ways to think about this communication is to be able to express your needs and opinions clearly and directly. You don't need to beat around the bush. Being respectful is being clear and direct in your communication in a respectful manner. You need to be well informed, you need to be calm, and you need to be prepared. It's very helpful to stick to one issue at a time and to ask for clarification when you don't understand. This may be something that's very difficult for a lot of families, to be able to effectively say, I don't understand, because we often feel stupid when we have to say, I don't understand what you're saying to me, I may not understand the term you're using, could you please explain it to me? But if we don't ask for clarification and we just go on, number one, we're not going to know all the information we need to know. Number two, we're missing an opportunity to help that provider understand that they may not be communicating effectively, and that could help other families as well. So don't be embarrassed to say, I don't understand. That's a part of good communication. So I mentioned listening. It's very difficult to listen when you're working on trying to figure out what you're going to say next. It's also challenging to focus on the other person and to focus just on listening to what they're saying, and then after they're finished, to be able to formulate what you need to say in response. But I would encourage you to really work on that. And actually, it's something that we can work on in any setting in our life, at work, at home, with our children, and significant others in our lives. So focus on listening before you are formulating what you need to say. Part of that is being prepared. Part of that is listening for the heart and with the heart. Sometimes in all of the systems that we're involved with, communication can be very frustrating. Working with all the different people we work with can be very frustrating. And we can enter into a relationship or into a communication or into a meeting already feeling angry and frustrated. And we forget that for the most part, all of the people that we're working with do their work because they care. So we need to make sure that we're listening for the heart and with the heart, and assume the best about the people that we're working with. Don't go into an encounter assuming the worst. Sometimes it's hard, but try to assume the best. So let's talk a little bit about going to the clinic and working with your child's providers. Number one, try to get a long enough appointment time. We know that our children require longer appointment times. Many clinics, especially primary care clinics, do allow for longer appointment times for children with special health care needs. So ask up front when you're making the appointment, are you able to get a longer appointment time? If when you make the appointment you are unable to get that longer appointment time, talk to the provider when you do go in and say, you know, I often take up 30 minutes of your time with our appointments. Is it possible to get a longer appointment time so that you don't get behind and we have enough time to get through all the issues we need to talk about? Simply ask. I really encourage everyone to keep a journal or a log about what's going on with your child's health and other related issues. This is going to really help you be better prepared for going into your clinic appointments. It is especially important if there's something acute or new going on with your child. If you're able to keep a log of what's happening, and that's going to not only help you better communicate what's going on, but it's going to help you remember the important parts of what's going on if you're keeping a journal or a log between appointments so that you can share that information in a more concrete way. Write down questions in that journal or log that come up in between appointments so that when you are at the clinic, you're able to remember the questions. I can't tell you the number of times that I've gone to appointments and forgot very important questions that I had because I didn't write them down. Another thing I think can be really important is how you prepare your child for a visit. And I know obviously this is going to be a little bit different between people and what you feel is appropriate to be able to prepare your child for. But it may be helpful to help your child understand what to expect, who you're going to be seeing, why you're going to be seeing that person. You may want to talk about what tests might be done. But the most important thing is the idea of helping the child understand why you're going to that appointment and encouraging your child to think about a question to ask the doctor, if they're able to ask a question, to be able to talk about a question that they might have, even a silly question. It doesn't matter. The idea is to encourage your child to start to learn some self-advocacy skills. Every child's different. Not everyone is going to be able to ask a question, but they can participate in some way. Maybe it's presenting their insurance card at the front desk. Maybe it's using a picture board to explain what's going on or to share how they're feeling on that particular day. But I really encourage you to think about how you can involve your child in this appointment and at all of the appointments that you go to. So during the appointment, we've talked about the importance of listening. It may be helpful to take notes about what you're talking about and what you're hearing. a very important communication tool is to repeat back to the provider your understanding of what you've discussed. Let me help you. Let me make sure that I understand what we're talking about and what we've agreed upon, and repeat it back so that it gives the provider the opportunity to clarify any information that you may have misunderstood or that the provider may have misstated. So repeating back is a very important tool in any kind of communication, but important in a clinic visit. And again, it's an opportunity to model good communication for that provider. Another thing that I really encourage all families to do is to develop a written plan. This often is going to take a little bit more time if we're talking about a very detailed shared care plan, and we're going to talk about that differently. But if you are at an appointment and you are making a plan for a specific sort of series of steps, such as your child needs to go in and have some tests done, or there's some specific follow-up that needs to be done with a certain provider, write it down as a written plan. And then include in that plan the plan for follow-up. So let me understand, we're going to go see this provider, and we're going to do it in the next 3 months, and then we're going to get back together following that appointment and talk about the results of that appointment. Reiterate that. Make sure that everybody understands what the plan is and what the follow-up is. It's really helpful to ask some very specific questions about what you're doing and what's going on, especially if you're dealing with perhaps a new condition, a new issue that may be cropping up that you're concerned about. What else should we be doing, or what else should we consider? This will help the provider that you're working with to maybe think a little more broadly, to maybe think a little bit outside the box. What are we going to learn from this test or procedure, and what are we going to do with that information? I think we all know that our kids go through a lot of tests and a lot of procedures, and I think it's always important to ask, what are we going to do with the information that we learn from this? Is it necessary? Is it an important test? Does it give us useful information? I think those are questions you should be asking your child's providers. And then I think we should always be asking, are there other providers who should be involved, especially if it's a new situation? Who else should be part of this discussion to try to figure out what's going on? So these are some helpful basic questions that I think everyone can be asking when they're working with their child's healthcare providers. If the provider doesn't have time to answer all of your questions or needs to look into an issue that you bring up, give the doctor your written list of questions and ask that he or she call you back or set up a specific time to come back to the clinic for follow-up. Especially if you don't have a long enough appointment, you may not have time to get all your questions answered. But if you can provide the provider with the list of questions that you have and then ask specifically for follow-up, that's going to really help. If you're anticipating a major discussion, a new diagnosis, or a major treatment plan, bring someone with you, a trusted friend or a family member who maybe can be that person to take notes so that you don't have to focus on taking notes, but then you've got those notes that you can refer to. Have that person especially write down what that plan was that you talked about. And then, again, make sure that you look for ways to include your child in the discussion or the plan. And again, that's going to just help them learn to become a self-advocate down the road. So when my child was very young, we worked on this, and I asked our son before an appointment, make sure you ask a question that you have. And my son said to the doctor, "Why are you wearing that red dress?" It was a silly question. Didn't have anything to do with that appointment, but it was an opportunity for him to learn that it's okay to ask questions and that you should have a question at every appointment. So there are going to be times when you disagree. That's absolutely a part of these systems that we work with. You can disagree without being disagreeable or angry. Some of the ways that we can demonstrate that we may disagree, but that we're not blaming that other person, is to use I messages rather than sort of blaming you kind of messages. By saying, I'm not sure I'm comfortable with this plan right now. It seems a little too aggressive to me. Could we talk about some other steps that we might be able to take? Rather than saying, you're always trying to be so aggressive. So there's two different ways of being able to express how we may disagree with the plan. And we need to be really thinking about how to disagree without being disagreeable or angry. And we also need to be thinking about where might we be willing to compromise. So there are some really good tools that we can use to help create compromise or to create agreement. So one of the ways is by identifying and clarifying and summarizing what the issues are. So in an appointment, you may have talked about several different things, and maybe there's just one area where maybe you're just not sure or you disagree with what the provider is suggesting. So if you're summarizing what the issues are, you can talk about all the areas where you feel like you agree, and then talk about the one issue where you're maybe concerned or you may not necessarily agree. And this will give you an opportunity then to talk about and generate some possible solutions. And sometimes we as parents have the ability to think more creatively about some possible solutions or interim steps that we may be able to suggest that the provider may not have thought about. So think about how you can build agreements along the way, and then also think about sort of a stepped approach. So, for example, if I'm going to go back, but for example, if the provider is suggesting a surgery and you really are thinking that you're not ready for surgery, your child's not ready for surgery, what are some of the interim steps that you could take before considering surgery? Are there some less invasive things that you could try over a period of time? How long should we give it that we could try maybe some different steps? Can we try some things for 2 months or 1 month and then get back together and talk about whether those things have worked or haven't worked? So thinking about a stepped approach to maybe trying something that you can feel more comfortable with, that your provider might be able to buy into, and then revisiting it and seeing how things are going before you consider perhaps a more invasive approach. So I'm going to jump ahead to talking a little bit about medical records. We've talked about what you might do before an appointment. We've talked a little bit about things you can do during an appointment. Let's talk a little bit about your child's medical records. I encourage families to get copies of all of your child's pertinent medical records. You may not need all of them, and you may not want to go back to get copies of all of them, but really think about what are the pertinent things that you may need and why do you want them. So one of the important reasons to be able to get copies of your child's medical records is to review them for accuracy. Sometimes there are mistakes, quite honestly, that are made in medical records, and having copies of them will give you an opportunity to review them for accuracy. It also gives you an opportunity to learn a little bit more about your child's diagnosis from the provider's perspective. And that'll give you also a resource for asking the providers questions about the diagnosis that maybe you had not understood before, or maybe there's terminology that you hadn't heard before, and it'll give you an opportunity to ask some questions and some clarification. Medical records can be really important if you're in an emergency situation. Many times we are seeing providers in multiple different locations, maybe at the university, maybe at Gillette, maybe at children's hospitals and clinics, maybe at Shriners, and there are records of our child's care in all of those different locations. Those records do not communicate with each other. And so you as a parent may have the most complete set of records about your child. And there may be certain specific tests that you may have reports about that may be really helpful to have in an emergency situation that may not be anywhere else. It can be helpful when you're communicating with specialists that you have sort of this more complete medical record about your child. It can also be really helpful when you're filing appeals or applying for public programs. It also gives you an opportunity to have a historical record of changes and improvements and trends in your child's health or about your child's health. So it's the law. You have a right to copies of your child's medical records. You may be asked to submit a written request to a specific provider. The law says that the provider should give you those records promptly, although it doesn't define what promptly means. You may be asked to pay a fee for copying materials. That fee should be waived if the request is regarding a current or acute medical issue. But the best way to get your child's records is really just to ask your child's primary doctor or the specialist when you're actually at the clinic visit. So if your child has had lab work done, for example, just say, I'd like to have a copy of that lab work for my records, and any other kinds of information about that appointment you can ask for a copy of. Usually providers are happy to just make a copy and give it to you before you leave the clinic that day. Especially this is going to be true if you have that good trusting relationship with the provider. So another reason to build a good relationship. I encourage families to think about ways that they can organize those records and the plans that they may develop. A lot of times families find it useful to use a 3-ring binder that you can divide into various sections. Gillette Children's Hospitals and specialty clinics have a 3-ring binder that they give to many families called All About Me, and it has some built-in sections for it. So if you bring your child to Gillette, you may ask your providers at Gillette if you could get a copy of the 3-ring notebook called All About Me, and that'll give you a specific place that you can keep sort of all the different information that are pertinent pieces of information about your child, such as a current care plan, your provider's names, addresses, and phone number, a basic health history, current and past medications might be important to put in there. It'll be helpful to have a place for that appointment and telephone log in that 3-ring notebook. You may want to include lab reports, x-ray reports, hospital summaries. You can put IEPs in there as well as insurance information. One of the reasons that a 3-ring notebook with all this information may be really helpful is if you have an opportunity to have some time away from your child and you have someone like a trusted family member or friend taking care of your child, you can give them that 3-ring notebook, and it can be a really helpful communication tool if they need to take your child into the emergency department, as an example, if something were to happen. You've got a really good, useful communication tool in that 3-ring binder. We talked a little bit about keeping notes, and we talked about it in relationship to certain acute things going on with your child. But there's some other kinds of notes that you may want to keep as well. I think it's important for every parent to have some type of a communication notebook and keep it by your phone. I encourage families to keep a written call log. Anyone that you speak with on the phone about your child, you should keep a log about. Write down the date and the time of the phone call, the name and the title of the person that you spoke with, that person's phone number, the reason for the phone call, the information that you received from that person, and the outcome or the follow-up that you're expected. This is, again, another opportunity for you to use your communication skills by clarifying the information that you heard from the person on the phone, by saying to that person, now, I want to make sure that I understand what we've discussed today, and clarify the information, and then write it down and tell the person, okay, I'm writing down the information that we've discussed, and you've agreed to follow up with me within the next week, and so I expect that you're going to call me in the next week with the information that we've discussed. Is that correct? There's no reason not to let that person know that you're writing this down, that you're keeping a record of it, that this is the follow-up that you expect, so that it holds that person more accountable for the phone call. It also provides written documentation about the concerns or the actions. This can be really important when you're talking with the insurance company or with the county, who often are notorious for not following up, so that if you don't get a call back from that county person in the week that they said, you can call back and say, hi, Mary, you and I spoke on Tuesday the 1st, and we discussed this information, and you were going to get back to me. I haven't heard from you, and I'm following up. If you have that exact date and time of the call, you've got written documentation. If you need to go to that person's supervisor and say, I've now spoken with Mary twice on this day and this day at these times. This is what we discussed. This was the outcome that Mary told me I should expect, or the follow-up, and I have not heard back from Mary. I'd appreciate it if you would please follow up on these issues and get back to me. I'm making a note here that you and I have spoken today and that you will provide the follow-up and feedback to me on this day. You can see how you can do this by being very businesslike and very, very professional, and without being angry and upset and out of control. You can approach it in a very businesslike way. People are going to respond to this much better than by you calling up and yelling at Mary because she never called you back, or calling and yelling at Mary's supervisor because Mary never called you back. You're not going to have much collaboration from Mary or her supervisor if you handle things in an angry way. But you have this documentation now that helps you be prepared. We talked already a little bit about why you may want to keep notes about changes in your child's condition and how that can be helpful when you're going into a clinic visit. Recording things like your child's temperatures or eating or sleeping issues or medication reactions or certain changes in behavior that maybe you're observing as a result of maybe a medication issue or something like that. Again, if you've got this written documentation that there's some changes that you're concerned about, rather than when you're in the clinic and you're talking with the doctor, you're sort of vaguely saying, well, you know, I noticed that there were some changes since we've started the medicine, but I don't remember when it started, and I can't remember all of the things that I've observed. It's very different than if you have everything really written down and say, you know, we started the medication on June 1st, and on June 5th, I noticed that my child was having significant issues with sleeping. He was only sleeping X number of hours, and then over the next few days it got worse. And when you have this information in writing, you are providing really strong and concrete documentation about what's going on with your child. And this is really important information when you're going into the clinic or you're calling the clinic with concerns and issues. So I encourage everyone to really use these kinds of written tools as ways of effectively communicating. I think every child who has special health care needs should have a written plan of care. It's something that I really encourage you to develop with your child's primary care doctor. You can let them know you'd like to work with them to develop a really concrete health care plan or plan of care. Not all primary care doctors are going to be prepared to do this, but you can let them know that you'd like to start working on it and ask them, how might they be able to help you work on this, and what do they have in their clinic system that maybe could help you develop a plan of care as a communication tool. You probably want to think about how often a plan needs to be updated, and then you need to be able to bring that plan with you to all of the different appointments that you have. I encourage families to be able to find a way to keep it in the computer. You may have access through different kinds of MyChart systems to an electronic plan of care that the electronic health record at your child's clinic may generate, but it may not be comprehensive enough for what you need. So you're going to really want to give some thought to what's helpful information to have in a plan of care that will help you be able to better communicate with other providers and other team members that you might work with. Some of the things that obviously are going to be important to have in a plan of care are your child's name, address, phone number, the date of the last revision of the plan of care, so that you know how up to date it is and the providers you're working with know how up to date it is. It should explain and describe your child's diagnoses or conditions, and describe what the current status is or current changes might be. The doctors who are involved in your child's care and include the last time you saw that child or that doctor or that provider and any important recommendations from that last visit. Current medications are important to include in this. I would also add that if there are any medications that your child cannot take or should be avoided, that should be included in here as well. Any kind of sort of normal values for your child, such as what your child's normal lab work is like. Your child's normal lab work may be very different from a typical child's normal lab work. So if you have a copy of your child's most recent labs and you go into the emergency department and they draw labs and they're crazy out of whack, you may be able to share with them your child's most recent labs to show them that, no, this is pretty typical for my child, or no, this is not at all typical for my child. You also will want to include information about your child's development, their likes and their dislikes. You may want to include things about what works or doesn't work for your child. So, for example, if your child needs to have lab work done, what helps to make it better? Does your child need to have their special blanket or stuffed animal with them? Or do they need to have, some special way of working with your child that would be helpful to communicate? Any other kind of pertinent issues about your child that would be helpful to be able to have this method of communication with providers. And then any kind of follow-up that's required or the date of the next update in this plan of care would be helpful to include. There are some resources for building a care notebook besides the Gillette All About Me book. There are some sample templates on the medicalhomeinfo.org website where you can actually download some templates for building a notebook. There's also a very simplified notebook that we have, I believe, or it's called the My Health Passport on our website. This may not be an accurate app, but I think we can get an accurate web link to you. Also, families should really consider whether an emergency information form might be helpful to you and your child. An emergency information form is a form that was actually developed many years ago by physicians and families, and it's a simple 2-page document that can be a really helpful tool that you and your child's doctor can fill out. That would be a very quick and easy way to convey important information about your child in an emergency situation. It's, as I mentioned, just a 2-page format. It includes a space for some of the information we just talked about in a typical sort of care plan, but it also provides a place for some typical protocols for that child, procedures to be avoided for the child in an emergency, and it should be signed by one of your child's primary providers. You can download this form from the American Academy of Pediatrics or the College of Emergency Physicians. It can be saved on your computer so it can be updated. I encourage you to do this with your child's primary doctor and have them sign it. It will add credibility to the form if it's signed by your child's physician. And some families have used this in a couple of different ways. They have it attached to their child's wheelchair. They have it in their child's backpack. They have it accessible on the refrigerator at home, so that if your child's in an emergency when you may not be there, at school, for example, there is some important, pertinent information that will help with communicating that pertinent information to providers that may be seeing your child for the first time, ambulance providers or first responders. So one of the other things that I wanted to mention is sometimes things just don't work right. It's not the right fit between you and your child's primary doctor. And I want to mention that you can change doctors if it isn't working, if the communication just isn't there, if the doctor just is not really in tune with children with special health care needs, and you just feel like you're just not working collaboratively together. It's okay to change doctors. And you can do it in a way without it being this angry storm off. You can do it in a collaborative way. Collect a list of names, check with your insurance to find out what the options are. Ask other parents who have children with special health care needs if they have recommendations. And then really think about what you're looking for in a physician. Think about what your goals are for your child. And think about what the quality of the care is that you're looking for. For me, in looking for a new physician for my child, it was really important that I had somebody who was really interested in being proactive and helping to develop all of these plans, proactive plans of care that we've talked about today. That might be something you can think about as one of your goals. You can request an interview and ask a variety of questions of the physician. Having an interview may be a difficult thing with specialists, but with primary care providers, they usually have time in their clinic schedule where they interview with new parents. So it's often a little bit easier in pediatrics than with a primary pediatrician to get an interview. Find out about their experience working with children with special health care needs and if they enjoy that kind of work. Will they work with you to develop a health plan or an emergency plan? Is there flexibility to have longer appointment times? How does the doctor handle communication with partners or specialists or emergency care? And then how would they transfer information to a new doctor? How can you help facilitate that? One of the other things that I just want to mention, I've talked a little bit about this as we've gone along, but a lot of the tools that you can use to really have good communication with your child's providers are models. You are modeling how to effectively communicate as you use these tools. And think a little bit about how you can improve the system by modeling good communication and good proactive care. That modeling is a way to improve systems for not only your family, but for the next family as well. So again, I'm Carolyn, and you can contact me directly, or you can contact Tricia, our Connected Parent-to-Parent Peer Support Coordinator, if you'd like to get more information. But I would like to open it up for questions or comments from those of us who are on this webinar today. I'm wondering, what kinds of comments or questions have been generated based on all this information that I've talked about?
Carolyn, this is Jamie O'Connor.
Yes.
Can you hear? Yeah. First of all, thank you, because this has completely re-energized me, and Nora has my daughter has a procedure coming up, and this is helping me sort of figure out how to get reorganized and re-energized about that. So thank you. I have two questions, and the first one is I'm wondering if you can talk about the difference between the role of a dedicated care coordinator and that primary care doctor.
That's a really good question, and I would say it depends. It's going to depend somewhat on how the clinic is set up that you're working with. A really good care coordinator and primary care doctor should be working together as a team with you. The care coordinator may be the person that you may more frequently communicate with than the primary care doctor. But Tricia, I'm wondering if you'd want to chime in and say something more about that.
Sure. I think that, Carolyn, you're very correct, and it does depend. But the key here, and that I've found, is to ask. When we were looking at a new primary care provider for my son and looking at the care coordination piece, I had a phone conversation with the care coordinator, and I asked about everything. How do you communicate with my child's pediatrician? How will you and I communicate? What will that look like? What's it within the scope of your role? What do you expect from me? I asked a lot of questions, kind of like an interview, and I was really pleasantly surprised with how the care coordinator answered those questions and how it was a piece that, I really had been longing for in my son's care. So I think that the best thing you can do is to ask that particular care coordinator and physician, how does it work in that clinic?
This is Jamie again, and I want to ask a follow-up question, and that's what happens when you have a care coordinator who's not a part of that particular clinic? Does that make sense?
Yeah. So that's where I think some of the differences come into play in terms of how clinics are set up and how they're doing care coordination. I would say, again, to ask the questions that Tricia just talked about related to, well, how does this work? How does care coordination work with this clinic? Or if the care coordinator is not a part of the clinic, what does that mean? How do they communicate with the clinic? How do they communicate with the primary doctor? And I would ask those questions of the primary doctor as well, or in the case of specialists, the specialist. If the specialist has some sort of care coordination going on in their practice, well, how exactly does that work? And what is it that you do? And all of those questions that Tricia just mentioned.
This is Tricia, and I have one more suggestion on that, too. We ended up getting a referral to a care coordination component within our specialty care, within Charlie's specialty care. So I straight up asked the question, no, this isn't going to replace care coordination within our primary care or medical home, correct? And they said, absolutely not. And they specifically said that they were designed to work together with primary care. So by no means did they want to replace, but just enhance what it is that we could be getting from that aspect of care coordination. So we've got a lot of it going on, and I'm excited to see how it kind of shakes out. I think it's going to be really good.
Hi, this is Rebecca.
Oh, go ahead.
I was just going to ask you Go ahead, Rebecca. Sorry.
No.
I felt like I've done a lot, known a lot about this stuff over a long period of time, but this is so good to hear these reminders and remind me of things that I've done in the past that I'm not doing now and I need to follow up with. And one of those things is we do have My Chart. We have that portal into the clinic, my daughter's primary health care provider's clinic, where I can get lab work and all that. But it really is much more effective to have my log and notes and who I talked to and what our changes were made in her plan and that follow-up. So it kind of reminds me that portal isn't going to give me everything that I need. It's that direct information with the clinic that I'm getting is what I need to keep track of and keep my log of. And then to have that and then look at my care plan will really help me develop more questions and updates for the care plan. So for me, this was just a great review and reminder to get back on that horse and stay organized and do what I can for my child's health care. So thank you.
Oh, thanks, Rebecca. Great points. Someone else was going to ask a question or make a comment.
This is Jamie again. I'm sorry, I feel like I'm hogging airspace, but I did have one question, and Rebecca's comment was a good segue. And that is, are there safe electronic resources for storing complete medical records? When we use My Chart, for example, that has all of my daughter's medical records from children, but it wouldn't have everything that we were containing in the notebook or binder that you're talking about. And in terms of sharing with other people, often nowadays that's done electronically. So I'm curious if anyone knows of a resource for storing that information.
Well, I know that there are, well, first of all, this is something that's being worked on in a lot of different places. And there are some different tools that families can use that are electronically based for storing information. The problem is sharing them with other providers can often be difficult. So I don't have a specific recommendation, but I would encourage you to sort of look around and see if you can find one that works for you, but keep in mind that it may be difficult to share that information electronically with your child's providers. Different clinics have different rules about email, for example, or downloading information from a specific patient portal that may not be part of their system. And quite honestly, and I would love to hear if anybody else has any other suggestions. Paper is a really good backup.
Thank you.
This is Rebecca again, and just to kind of piggyback on that, I struggle with the same thing, Jamie, of, where do you keep all of this and what's safe? And I don't know how safe it is, but I do keep my daughter's emergency information form on my phone because sometimes I don't have that piece of paper real quickly, and it's on my phone. It's easy to update, and I can usually share it. If nothing else, open it up and show someone on my phone. But that's the only thing that I really keep right now because that same issue of safety and access and all that. So if someone comes up with a better idea or a safer measure, I'd love to hear about it.
This is Tricia, and I just can't ever remember all of my logins and passwords for the different portals to the health systems. That's my biggest challenge.
Any other comments from people? Well,
this is Terry.
Not, go ahead, Terry.
Oh, I just wanted to say that my kids, aren't as medically involved as a lot of other families, so we don't have nearly the amount of records. But even for me, I mean, it was a good thought that I should be organizing the stuff that we do have, just to make it a little bit more accessible, and especially with the medication changes. Yeah, I often go in and go, oh, we started it about this day, and so yeah, it was a good reminder that I need to be keeping better records for myself and not just depending on the doctors to know when that is.
Great. Thank you. Well, thank you, everybody. I appreciate you listening in on this webinar today, and I hope that it was useful information. And please stay tuned for our next webinar that's going to be coming up next month related to care mapping. So thanks, everyone, and have a great day.
Thank you.